So first of all, I'd like to thank everybody for joining the webinar today. This is the first of our webinar series for the fall 2019 series with the Canadian Donation and Transplantation Research Program. So my name is David Hartel. I'm the Executive Director of the network. And we're very excited to be starting a new season of webinars and training opportunities for the research community, for our trainees, for our patient partners, and for all members of the community that are interested in donation and transplantation. So today is exciting because it's a little bit different in terms of what we're doing. We're actually, instead of our traditional webinars, which focus on different aspects of research or looking at new research methodologies in donation and transplantation, today we're kind of taking a different approach and looking at what are some of the other aspects around how you do research that will really influence how you're able to get your message out, how you're able to promote your work, how you're able to essentially build your own brand and communicate with others around the world about the important work that we're doing. And so this is the first of two webinars that we're doing, really focused on how to use social media for your own professional development and within your research. And so in a moment, I'm going to turn it over to Stephen, who's going to do the introduction for today's speaker. But I do want to make a plug for our next webinar, which is happening on Monday, September 16th at 4 p.m. So not on a Tuesday, but on the Monday. And you can find information on our website, but it's going to be with Kate Headley, who is a principal at Macmillan Vantage Policy Group. And Kate is going to talk about different approaches for maintaining a social media presence, for how to build an audience, how to generate content, and how to generate and gain ideas that you can use. What are the right things to use on social media? So that's going to be on September 16th. That's the next, that's the second of this part. So without further ado, I'm going to turn it over to Stephen, who's going to give the introduction for Sapna. So Stephen?
Thanks, David. So I'm pleased to welcome Dr. Sapna Kudchadkar, who is an associate professor of anesthesiology and critical care medicine in pediatrics at Johns Hopkins. She's also a pediatric physician of physical medicine and rehabilitation, also at Johns Hopkins. Her research interests focus on sleep disturbances and delirium in children, sedation of mechanically ventilated children, and rehab in the PICU. She initiated the PICU Up program, a pretty neat program. I was reading about it today. An innovative quality improvement initiative that strives to improve the outcomes of in critical care. For example, reducing oversedation, improving mobility, reducing delirium, and reducing hospital length of stay. So it's pretty obvious that she's busy, and so we'd like to take this moment to thank you to take the time out of your day to talk to us about social media and research.
Absolutely. And just to confirm, Steve, can you confirm that my volume's okay and you guys can all hear me?
Sounds good to me.
Okay, perfect. So let's go ahead and get started. So thank you so much for the opportunity to do this webinar. Clearly, this is an area that I am very passionate about. I have a hat as a clinician scientist. I'm a practicing pediatric intensivist and anesthesiologist. And my role with social media actually started with my interest in bringing together a pediatric critical care community, which you'll hear a little bit about as an example of kind of the future of where transplant professional social media could potentially evolve. I am the associate editor for social media for both the Pediatric Critical Care Medicine Journal and Critical Care Explorations, which is the Society for Critical Care Medicine's other open access journal. So with no further ado, let's get started. So I know that I recognize a few of the names that are on the list of audience members, and welcome to all of you. And so it's clear that probably we have some very novice folks who are new to healthcare social media, and some folks attending who maybe have started a little bit of progress on social media but are here to learn more. So the first step for those of you who are novices is obviously follow me. So if you want to get started to kind of learn a little bit more about how to dive into social media, please do follow me and follow these hashtags that I've listed here: transplant research, donation research, and hashtag transplantation. The last hashtag is actually the one that is actually registered, and we'll talk about what registering hashtag actually means. And obviously, please do follow the host of this webinar, the Canadian Donation and Transplantation Research Program. They have an awesome Twitter profile handle and a lot of cool things that they're constantly talking about on their profile. So I think that I'll start out by first mentioning that usually when people think about professional social media, this is the original kind of perception that people have. Doesn't matter young, old, senior, junior. It's obviously a bit daunting to think about how you would start to navigate social media as it comes to your professional career. I just want to give a shout out to the American Association for the Study of Liver Diseases, who obviously is very involved in transplant work, but has an awesome social media guide. So if you look up, you just Google their social media guide, AASLD, and this is clearly a list of all of the different social media platforms that are out there available for us as healthcare professionals to engage in. So the context and the time for this talk doesn't allow us to go into all of those different platforms. So we're just going to focus on one specifically today, and that's Twitter. So when you think about social media, again, often we kind of compartmentalize all of these different platforms, right? So Twitter is in the moment, I'm eating a donut. Facebook is, I'm going to talk about how much I like donuts, and going on and on into the different platforms. So the reason we're going to talk about Twitter and focus on Twitter is because it is in the moment, and we want to learn and disseminate information and learn from each other in the moment. So that's all good, but what can social media do for you? Why is it worth the time and effort? Why are you here to learn from me during this webinar about what's involved? Well, again, a really beautiful resource from the social media guide from the AASLD. For researchers and for clinician scientists, there is a multitude of different reasons that you should be on social media. Number one is reaching new audiences. You can actually discuss and collaborate with people that you never would have thought possible inside the walls of your own institution. I'll give you some great examples of that. Collaborations, following up-to-the-minute news and industry events. If you are on social media, you will always be up to date on what is relevant and timely in the moment. Obviously, from a clinician perspective, networking with our fellow clinicians, getting second opinions, thoughts about a specific maybe clinical issue that we've tackled in the past, and also to learn about the most recent controversies and discuss those as well. So why Twitter? Well, I use Twitter as a way to complement lifelong learning. It has been an extraordinary way for me to initiate new collaborations and interface with my own community, and for all of you to potentially interface with the international transplant research community and beyond. And so I just did a quick search of all of the most relevant and highly used hashtags within the transplantation community, and I've listed those there, including hashtag kidney transplant, hashtag liver transplant. Being a part of timely and relevant conversations, I'm going to sound like a broken record, but I'll keep bringing that up. That is a critically important reason to be engaged on Twitter from a social media perspective. We're also going to talk about how you can use social media professionally to enrich your conference experience, or potentially even attend a conference long distance that you weren't even going to be able to go to. And finally, the reason we're all here is to talk about how you can expand your clinical and your research network and disseminate your own research widely. So my perspective, even though most of you are listening are probably not pediatric ICU physicians or practitioners, I really stand behind this quote from a foreword that we wrote when we started our entire social media initiative for the journal. It is evident that we have much to learn from each other, and the cycle of local to global communities of practice can be fueled by leveraging social media. So what does that mean? Essentially, in addition to disseminating information and sharing, I want you to help me help you with your career development. Social media can be an incredible way to expand your horizons and also build your own career portfolio moving forward. And we will talk about some examples of that. So, social media for professional benefit. I think it's always easiest to break it down into the different ways that you can use social media professionally. The first one is, I think, a little easy to think about and remember. It's basically learning. So interacting with your colleagues, gathering information, learning about the most recent research, teaching. It can be a source of timely, credible education for not only our trainees, but also other colleagues and the public as well. treating. We can engage with patients about care. We won't get so far into that specific, that can be a whole other talk on its own, but definitely it is a way that many healthcare professionals engage with their patients. And it is also a way, believe it or not, for you to actively protect and control your own reputation. So there are many, many levels of social media engagement, level 1 through 5, and I'd like to thank Dr. Chris Carroll for this slide. Level 1 is what we call, and what I call affectionately, the lurkers. So the lurkers are people who are watching the conversation from afar and deciding whether they really want to engage. So I've had a multitude of people come to me at conferences and say, I follow you on Twitter and I never tweeted before, but I really love taking in all the information. So that's level 1. Level 2 is actually like starting to like things a bit, maybe saying, retweeting things. Level 3 is engaging, starting to do some posting. Level 4 is actively sharing your content with others. And level 5 is actively contributing. So this is creating original content, posting a poll, asking a question, putting up a photo, tagging other people. How do physicians use social media? And this is just obviously one group of healthcare providers. 61% of our colleagues, physician colleagues, use social media for professional purposes, and that includes collaborating with patients and peers. 88% of us are actually just, posting, commenting, and/or reading for professional purposes. And surprisingly, 62% are using it in some way, shape, or form to communicate with patients as well. Believe it or not, social media has taken on a whole platform of its own in terms of professional academic medicine, which is why I'm giving this talk. This is a great resource from the Harvard Medical School Global Academy about the role of social media in academic medicine specifically. And there are some institutions, Hopkins included, where I work, that have actually started to create formalized processes and pathways for evaluating someone's social media impact and how they're using social media in an academic way to actually use that for academic promotion and tenure. For example, on my CV, I have a specific section focused on social media and the impact that I've had in various realms within that community. Scientists on Twitter. So the other reason to be on social media, in a way, is it's our responsibility. If you look up hashtag SciComm, SCICOMM, this is a very well used and popular hashtag about how scientists often do this amazing, incredible work. However, we're just kind of preaching to the choir. We're talking to ourselves. We're disseminating research to each other just so it gets cited again by another researcher. However, we should be sharing it across that border, singing it from the rooftops. And social media is a wonderful way to do that. One thing that I always tell my trainees is when we do research, we're not just doing it in order to impact other researchers. We want it to get to the people at the bedside, the clinicians who are doing the work in the trenches, whoever those people are. So politicians, government agencies, who are the stakeholders who are making the policy that impacts so much of what we do, particularly maybe in the transplant community as well. The general public can play a significant role. We want journalists to hear about our work so that they can disseminate it and move it broadly beyond the walls of our own research community. If you're interested, there is, even though it's not specific to transplant community, this is an article that we wrote most recently about social media engagement in the critical care medicine community. And essentially it's a how-to on how to use social media in healthcare as a professional. And I would like to point out, this is an example, and I'm going to show you many examples of good tweets, tweets that sponsor people, tweets that disseminate your work, and tweets that actually connect with all of the different networks. So when this article came out, obviously it's something that I wanted to talk about and tweet about because people on social media would be very interested in it. So I used hashtag SOME, which is the hashtag for social media. I tagged my co-authors, Dr. Sean Barnes, who's one of my mentees, and I want to point out Byron Cowell here. I recommend following him as well. I have never met Byron in person, ever. However, we met each other on Twitter. We had this shared passion and interest in social media and professional lives and decided to write this paper together. So another example of how social media can bring people together that perhaps never would have worked together. And then I used other relevant hashtags for the community, included the link to the article. This is critical when you share your papers. You must include the link, otherwise you may not tweet it as well tweeted at all. So let's talk a little bit about the basic terminology of Twitter specifically, the code. So there's things, for example, a handle. I think it's pretty self-explanatory. My handle is @SapnaKMD. That is my username, or the organizational username, for example, for the Canadian Donation Transplant Research Program. Hashtags are essentially keywords. They're the keywords of the social media community. So just like you would tag a keyword when you write a manuscript, for example, transplantation, hashtag transplantation is the way you can find something on Twitter. If you put it in the search box right now, you'll find all of the tweets that were connected to that specific hashtag. Liking a tweet is essentially pressing the little heart button to say that you acknowledge that you like what something that someone said, and retweeting it is sharing it basically across the board to all of your followers. And then we'll talk about some other ways that you can not just retweet content, but actually share your own perspective along the way. So here's an example of a tweet that I sent when I was at the European Society for Pediatric and Neonatal Intensive Care. And Julie Menzies is a woman who I got to work with, collaborate with, and I wanted people to know that she's a great person to follow on Twitter. So I tagged her handle there. I included the relevant hashtag. She's a nurse. She's a PhD nurse, and included Peds ICU, which is our critical care community hashtag. She speaks on ICU rehab. That's also an established hashtag, and I used the conference-specific hashtag. So in that one tweet, I was able to connect with a lot of people, not just the people at that conference, but the people who follow all of these different keywords that are relevant to them. So how did I get started with social media? Well, essentially, I started with hashtag ICU rehab. So Dale Needham, for those of you who know the critical care rehab literature, is one of the great leaders in that area, and had started this hashtag with Michael Friedman at Johns Hopkins for a rehabilitation conference. And over time, that hashtag turned into something for the entire ICU rehab community. And it's a rich, rich compendium of all things ICU rehab across the world. So then I got a little jealous and I said, well, how about the Peds critical care community? So we actually started our own hashtag specifically for pediatric critical care. I want to be clear that hashtags aren't owned by anybody. They're for everybody to use, and I just wanted to start this. So I actually registered this hashtag on this website called Simpler Signals. And so you can look up Simpler Signals on Google. Anyone can register any hashtag if you would like to start collecting data on that specific keyword. So we started that in February of 2016. At the time, I was a one-woman show. I was going from conference to conference trying to convince people to use this hashtag, which was relevant. And luckily, the editor-in-chief of PCCM, Pat Kohanek, had a vision. He said he didn't know much about the social media business, but he said, this seems like something that is the next frontier for the journal, and brought me on as the associate editor for social media. So just very briefly to show you the impact of what social media did for our journal and is now doing for all of the transplant journals that you are all reading, we increased our Twitter followers from 742 to 5,000 over the course of 2.5 years. The number of social media content views has astronomically increased, and we have a huge number of Facebook followers. Why is that important? Well, we have started to go beyond the walls of North America and Europe, and we're starting to capture readers from across the world that we never were before. And so the number of social media clicks has gone up significantly, and we're capturing a number of countries that traditionally would not have had access to the materials when we were just disseminating it via print and online. And you can see here that the global interaction of our hashtag is substantial. So how does this all apply to you? So in the next several slides, I'd like to take this opportunity to share some examples from the transplant world and also from the Peds critical care world to inspire you on how you may start to want to start your social media journey. So, for example, the Canadian Donation and Transplant Research Program does an exquisite job. So if you're not following them, again, you must follow them. And these are just two examples of some great tweets that they sent out that tagged the appropriate people. They tagged the folks who are speaking at the webinar, for example. And as I was scrolling through their feed, you can see that they have a ton of awesome resources. So if you follow one account, you're already learning about all of these free webinars and resources that this one group is putting out there. This is yesterday. I just went in and put hashtag transplantation and hashtag transplant into the search engine in Twitter, and these were the two top tweets that came up. So for example, the NHS is celebrating Organ Donation Week. So they obviously are doing a lot of advocacy work surrounding that to increase awareness of organ donation. And this New England Journal article actually was the top tweet about a transplantation of kidney into a 9-year-old, and the donor kidney was found to have 5 renal arteries. So again, anyone who was following that hashtag transplantation would have come across this content immediately. Along those lines, social media, sometimes people get scared away from it because it seems like it's overwhelming. It's like drinking from a fire hydrant. On the flip side, though, it can be used to actually filter content. So I personally use social media to bring the content that I am most interested in directly to me. So for example, I only follow people who have similar interests or similar passions, or put stuff out there that I'm really interested in learning about and interacting with and talking about. Your network can bring relevant content directly to you. I think all of you would agree, as folks engaged in transplant research, that it is really, really, really hard to keep up with all of the literature. The number of papers that are coming out on a daily basis that are relevant to each of our fields is astronomical. As you can see from this graph here, from 1950 to 2010, the rate has doubled over the last 20 years of new content. And the bottom line is that we can use social media as a tool to disseminate, access, and evaluate new information. So as it comes to us, we can decide whether it's something of interest, but it also helps us to engage in dialogue in a timely manner. So this is another example of a tweet that came out from the same account from the Canadian Donation and Transplant Research Program. They are advertising how they have 18 new projects into a national research structure. So everybody can learn about that instantaneously. You don't have to wait for the newsletter to show up in your inbox. It's something that you can read about if you're interested in, and you can learn about all of these different organizations that have come together in this collaboration. Across the board, and I'd like to thank Dori Segev, one of our transplant gurus, obviously, who's right here at Johns Hopkins, for sharing some of his slides. There's really been broad adoption of social media across the academic literature. So as you can see, all of these major journals have very active social media accounts, including Transplantation, the journal. And last night, when I was going through, I wanted to make sure I captured as many of the transplant journals as possible. But as you can see here, across the board, many of the journals that are focused on transplant issues have very active social media profiles and accounts. Some are more active than others. However, they are all tweeting about the articles that they're publishing. As I mentioned, hashtag transplantation is a formally registered hashtag on Simpler Signals, which means that there's actively data being collected about who is tweeting using this hashtag. So I encourage you, if you start tweeting today, include hashtag transplantation in there so that you can get captured as a part of that. And here are the people who are leading the way over the last month in this specific hashtag. So you can see there's a lot of different organizations and journals that are tweeting about it, in addition to individuals as well. And in the last month, there were 584 people who participated in tweets about transplantation. But there's an opportunity for more, which is why I'm here. So the goal is for you to end up on this leaderboard. You want to join the conversation. We want to see your profile photo up here as one of the people who is talking about transplant. Another reason to become engaged in social media is to disseminate your research. I cannot emphasize this enough. So as I mentioned, all of the high impact and specialty journals relevant to our field have active social media profiles. And if you have a Twitter handle, it is a direct conduit from you to your readers as the author of a paper. So for example, as the Pediatric Critical Care Medicine social media editor, if I know that a first author has an author handle on Twitter, I can tag them in the tweets that I send out, and it's an automatic way for someone to click on this paper when they're interested and say, oh, hey, I want to learn more about Sapna KMD, the first author of this paper. The other reason is it's really important because it does reach the people at the bedside doing the hard work who may not have access to an institutional subscription. And they are following these feeds actively to filter the content for themselves to find out what's relevant to their bedside practice. Highly tweeted articles are 11 times more likely to be cited. We've actually had research on this specific topic, and articles that are randomized to Twitter promotion receive nearly 3 times as many page visits compared to controls. So again, promoting research on Twitter can make a significant difference in the amount of time it's not only read, but also cited as well. Can tweets predict citations? So obviously, papers that are of high interest are going to be cited more, but they're also likely to be tweeted about more as well. And I think the really cool thing about this graph, as you can see, is that it takes a long time for a paper to be cited, right? By the time it hits press and it's out there, someone else has to publish their own research that's citing your paper. But the beauty of tweetations, or twimpact factor, as we cutely call it, is that it's instantaneous. As soon as your paper hits press and there's a link online, it can start accruing interest and reads, and we can actually start collecting information about its impact on the public. So here's an example from the Canadian Donation and Transplant Research Program tweeting about an article that they were collaborators on. So injury-derived autoimmunity, you can see here in Human Immunology, and this is a very nice tweet listing the first author and the affiliated organizations with a direct link and another organization that's also associated. Here's some more examples from transplant journals. Here, hashtag visual abstract. We're going to talk about that in a second. So this paper actually had a very nice infographic associated with it, included the handles of people who were associated with the article, and also included a link as well. And you can tell that this is a tweet that's going to get some attention because it's easy to read, it draws the reader's interest, and the images are very inviting. Also, the American Journal of Transplant had this really cool collaborative way of submitting manuscripts and collaborating with the transplant community. They actually had a Dropbox link that was used for that, so they used that modality on the social media platform to advertise that. There are transplant journals now with social media editors. So this is the Pediatric Transplantation Journal just recently announced that they have a social media editor. And they have a really nice infographic describing the process, which is essentially the process that I use for pediatric critical care medicine. So you as the authors are creating this amazing content. You submit your article. It gets peer reviewed via traditional routes by the journal itself. It gets accepted. It has a link. And then what we do as social media editors is we make sure that it gets out to the world. So we get it out to people, we get it out to organizations, and we get it out to all of the different social media platforms that we feel that it will have a significant impact on. The visual abstract has really revolutionized the way social media editors and social media is used to disseminate research. And this is from the Transplantation Society talking about their new way of using visual abstracts for the journal. And this is a great editorial if you'd like to read more about it. All of the details are in there. But let's just briefly go over what the basics of a visual abstract are. They're very simple. It's a take-home message that you want your reader to have so that they will click on the link and read more about your paper. So this is a great one about iron deficiency anemia before major abdominal surgery. Andrew Ibrahim does a great visual abstract workshop if you want to follow him, and he provides great resources on how to create a visual abstract. You summarize the key questions, summarize the outcomes, you include the citation and the author, who created the visual abstract. Often it's the journal, but it doesn't have to be. You can actually take a proactive role in that, and we'll talk about that as well. And then a visual display of the outcome is very key. So here are a couple examples from transplantation, the 2018 Declaration of Istanbul on organ trafficking and transplant tourism, again, using some very easy to view images, and the take-home points are all right there. Same thing, very relevant to our webinar today. How should social media be used in transplantation? A survey of the American Society of Transplant Surgeons. So they surveyed 299 of the members, and you see there was a bit of a cross-section of different folks there, and that they had a stronger belief in social media's influence on living organ donation if they were younger and had fewer years of experience in the field, which I don't think is a surprise to any of us. This is a hot off the press article that just came out on sex and gender considerations in transplant research. And a figure like this, it's beautiful. There's no infographic for this study yet that I could find. However, an infographic like this would get a lot of attention. So as you're creating your manuscripts, think about the infographics that would actually translate well to social media, because you can imagine if this gets posted on social media, people are going to be interested in reading the article. Keep an eye out, because more and more journals are asking you to actually provide a tweet with your article. We do that now for PCCM. The reason is because we want to ensure consistent, unbiased, and accurate messaging. You guys are the authors of your papers. You know your study the best. There's no reason that I, as the social media editor, should be putting together a random tweet summarizing what I think of the article. You should be telling us what you want the take home to be. So it facilitates author engagement in social media dissemination, and it forces you to kind of take a step back and think about, what is that 140 to 280 character message that I need to get across? So for the Pediatric Critical Care Medicine Journal, just an example, and this is what many journals use in terms of their format. Here is a basic title slash take-home message, including all of the relevant hashtags here and the relevant organizations that would be interested. Unfortunately, Kashmar here did not have a Twitter handle, so there is no direct conduit to the first author for this tweet, which is why I wanted to show that. But the senior author did have a Twitter handle, so I included that. And then again, no one who wrote the editorial had a Twitter handle, but we did tag their institution. So again, you want to have a handle so that you can be tagged for the hard work that you've done. We're very results driven, so all of this work is based on data. So I can't have you guys raise hands in the moment, but I always ask how many people know what an altmetric score is. And the answer is that most people aren't able to actually describe that. So almost every journal out there now uses the altmetric score as a way of measuring instantaneous impacts. So the higher altmetric score, the more impact it had on an online platform. So this is an example from the PCCM journal. 70 is a pretty high altmetric score, and this is a prevalence of acute critical neurologic disease in children. The reason it has a 70 is it was picked up by 7 news outlets. So it was timely, it was important, and it was relevant to not only the medical community, but the public at large. It was tweeted by several people, and it was on a multitude of different social media platforms, hence the altmetric score. So get to know your altmetric score. It's a way for you to see how much impact your paper, your research, your article is having on the world at large. Another thing I wanted to focus on here is the role of Twitter on conference experiences. So I'm sure many of you have been to a conference where the meeting is being live tweeted, or live tweeting the meeting. So this is a really awesome way to kind of start your foray into social media, because it's in the moment. You're at a conference, usually don't have a bunch of other competing interests because you're there. You might as well tweet about it. Conference attendees can actually interact with speakers or other participants through the use of hashtags. So the upcoming meeting for the Canadian Donation Transplant Research Program is CanTX Summit 2019. That's the hashtag that's associated with the conference. The other reason to live tweet the meeting or follow the hashtag for a conference is we all are busy. We can't attend every single conference that we want to go to. So following the conference specific hashtag is an awesome way to share the content if you're sitting in the meeting room, or actually take in the content if you're actually the one who has to stay at home to work or care for your family, etc. You can also ask questions via Twitter, and you can pose discussions, and you maybe even start a controversial question. So it's a really great way to be engaged. So for example, the American Transplant Congress, there's their hashtag ATC 2019 Boston. Oftentimes these hashtags are registered. If you ever throw a conference, please register your hashtag. You can reach out to me to talk about how to do that, because then you can have live metrics of who's engaging at your conference. So this was the SBIC 19 conference that I mentioned previously. So this is just a tweet I sent out that a lot of people liked, because I said what I'm looking most forward to is getting out of my American Peds ICU bubble and learning more about global Peds ICU. And I was able to share one of my colleagues' work and his talk there. Here are a few more examples from ATC 2019 Boston, looking at ABMR treatment. And here is the ESOT 2019 Congress in Copenhagen. So again, you can start to get the word out early and often about upcoming conferences. Dori Segev shared this slide. It's also a great way of just sharing what our colleagues are doing. So taking lots of photos of people presenting their posters or giving their talks, using their handles so that, again, we can sponsor each other, we can mentor each other, we can collaborate with each other and learn more about what each other is doing. This is the Society for Critical Care Medicine conference engagement, just to give you an example of what's possible. Over 5 days of the SCCM Congress last year, we had 75 million impressions. That means that 75 million times content from the SCCM meeting was actually engaged with. And there were 2,563 participants. Were all of those participants at the conference? Absolutely not. The majority of those people were tweeting or engaging from the comfort of their home or workplace in their own country. Another reason I love using social media in healthcare is it exposes me to things that I potentially would never have come across. For example, if I asked for a show of hands of how many of you read the American Statistician on a daily basis, the answer would probably be very few. And I don't read the American Statistician. However, they put out an awesome article about data organization and spreadsheets. Such a basic concept that is so important for every researcher. I have many mentees who have never learned how to put together a spreadsheet, and I had to learn along the way as well. So to have this primer that I could share broadly, and it got a lot of attention. So again, exposure to things that we normally wouldn't come across. I don't know how many of you are interested in inpatient rehabilitation, but clearly this is an inpatient rehab paper that is relevant to the transplant community. So if you're following #transplant and the people who tweeted this article from the PM&R journal knew to use that hashtag, they can use this for cross collaboration across communities. I could give an entire 2-hour talk on the role of social media, the role of advocacy in social media and healthcare. These are just a few of the hashtags that are widely used for advocacy within the organ donation community and the transplant community. This is from Transplant Manitoba from a couple months ago, obviously trying to make sure that everyone knows the huge impact that the donor registry and donation decisions have had. Here's an example from a vaccination video that we had from the American Academy of Pediatrics and sharing that. And you can see we used the specific hashtags for that advocacy program, Why I Vax and I Vax to Protect, as obviously it's a big hot topic here in the United States. One of my colleagues in the PICU had a Chicago Sun-Times article about gun violence and how it impacts us as pediatric intensivists. Again, something that she shared and went viral because it was of so much interest to so many healthcare providers. And here is another tweet from July 4th of this year from Trillium Gift of Life, talking about Ontario earning a new record for organ transplants and deceased organ donors. Social media can be a great way to promote our own trainees, and many of you are trainees who are listening into this talk, and I do want to point out how it can be used to promote our own trainees and our faculty. So this is an example of just a few of the social media accounts that have been started by pediatric critical care fellowship programs who have now started to engage with each other for medical education. And we can use it to celebrate each other. So when I was at the World Federation for Pediatric Intensive and Critical Care Societies, Vijay Williams won the Head Research Star Award. So we're able to talk about him and his successes, and it was a great way for him to connect with an international community. In the Johns Hopkins PICU, we have fun. We shout out to our fellow for spreading holiday cheer, getting dressed up in a Santa suit. Whenever our fellows publish articles, we're able to share that as well. This is the Children's Hospital of Philadelphia. They tag the first authors and the PICU fellows who are involved, had a great infographic on this quality improvement manuscript. And again, more articles that are being promoted, because when our trainees do awesome work, we should be sharing it. And we can use many different forums to do that. And if they have a Twitter handle, it makes it all that easier. This is the JH Neuro PICU sharing information about a high impact article from one of our junior faculty members. We can share whiteboard teaching, so collaborative medical education. So we all do a lot of whiteboard teaching in our work. There's no reason that we can't share that. So this This group used relevant hashtags, Peds Anesthesia and Peds ICU. Book club. So we read journal articles together, we read book chapters together, and we summarize them. So this is another example of that as well. We can start online journal clubs. And so I don't know if any of you are interested in this, but if someone would like to start a transplant journal club, this would be something that I think a lot of people would be very interested and passionate about. So you can check out the different opportunities there. I did want to say a brief word about social media and study recruitment. So social media can be a way of recruiting not only patients, but actually sites for studies. And I'm going to focus on sites specifically because it can be a great way to get your message out there beyond traditional email listservs, etc. So it's free, which is one of the huge advantages. It allows you to extend beyond international borders, and it offers the potential to engage with collaborators who may not be engaged in other traditional methods. So maybe someone never checks their email, but maybe they're on social media all the time, so you can capture them. The bias is that you aren't able to capture countries that don't traditionally engage in social media. For example, in China, there's not a lot of Twitter usage, for example, so that's something that needs to be thought of. And also people who maybe are more senior aren't using social media as much, so that may not be the only way that you're going to engage folks. So the prevalence of acute rehab for kids in the PICU study is a study that we just finished with over 200 sites, and I wanted to provide an example of how we used Park PICU and social media together. So I started tweeting about Park PICU. Check out our new Park PICU website. Here are the relevant hashtags. If you want to learn more, put in your info if you're interested in participating. Fear of missing out, or FOMO, if you haven't heard the term, can be an important strategy. So we put out what sites have been registered within the United States, and all of a sudden, lo and behold, there are more sites who wanted to get involved because they saw there was a hole where their institution's located. Put a Santa hat on our Park PICU logo. It's not too late to join, get folks involved. It's Valentine's Day. We've extended to Canada, Brazil, and Europe. We're actively recruiting sites. We use Google Translate. So we actually started tweeting in Portuguese and tweeted out the link to our Portuguese newsletter for the Brazilian study. And this young woman decided to make a video about Park PICU, and actually 30 sites were immediately, instantaneously enrolled after this video went viral in Brazil. So it was an outstanding way for us to get sites involved. We have folks within our community who use social media to curate content, bringing together all of the most important articles in the Peds ICU community. And we can share clinical progress. So earlier they mentioned the PICU Up program, which we started here at Johns Hopkins. It started with this quality improvement manuscript. We started sharing our successes on social media. All of these photos were shared on social media with explicit patient and family consent. I want to mention that. Here's one of our patients in a little cozy coupe car. Here's a couple of our nurses taking a baby for a walk at night. And then slowly but surely, other sites started to share their successes. Here's a little guy in Brazil pushing a shopping cart on post-op day 1. Here's a new program that got started out in Scotland. And we can still have fun. So we talked about bringing a cow to our Pediatric Intensive Care Unit. And then the Rainbow Babies Pediatric ICU talked about bringing their therapy pony. So again, social media is not all always work. We can have fun as well. So what about patient care? Again, another 1-hour talk specifically, but I did want to mention that there are some emerging data and research focused specifically on the role of social media and dissemination and communication with the public and how it impacts living donors and transplant professionals. There's actually a research protocol right now to see how social media can be used in consultation with the adolescents who've undergone kidney transplants. And obviously, with all of this comes a lot of stuff regarding ethics, the ethics of navigating the next frontier of social media as it relates to organ donation. And this quote that I have at the bottom left really, I think, puts together all of the issues related to confidentiality, privacy, professionalism, and informed consent that may have a potential impact on how social media is viewed in the transplant community, which is why today we're focusing solely on your own professional career development. So a brief intro to Twitter. I don't think I need to belabor how to open a Twitter profile or a Twitter account. What I do want to make sure I emphasize is do not let your profile look like this. This is a very unengaging profile. If you want people to follow you, you need to have information on your profile that is actually relevant to the people who are potentially going to follow you. So again, from the AASLD, you want to create a profile that showcases your presence in the healthcare profession as a thought leader or a credible source. So you may not feel like you're a thought leader yet, but you're destined to be, and you already are whether you know it or not. So you want to have a professional headshot, and your actual description on your profile should tell us about you specifically. So this is the same guy who didn't have a great profile earlier. Now he has a great profile. It tells us who he is, uses the context-specific hashtags, and actually includes a website link as well. Here's my profile. Again, this is what I did. I included tagging the other accounts that are of interest to me and obviously that I'm focused on in my role, and then all of the relevant hashtags to my research work. Here is Dori Segev's. I encourage you to follow the epidemiology research group in organ transplantation handle, website, what he does, and obviously they have quite a few followers as well. So what do you need to do? You need to get a Twitter account with a professional handle, and keep it separate from your personal handle. There's many reasons for this, but it's easier to create a brand as a healthcare professional when you don't have a lot of personal stuff leaking in. So yes, sometimes a professional account may get political, and you have to be careful about how far that goes. But you know, one may consider vaccines to be a political concept. However, it's important to the patients that I care for, so I tweet about it, and I tweet about the importance of getting legislation through relevant to vaccines, for example. When you're tweeting about sports or putting up a lot of family pictures, often people aren't sure exactly what your account is focused on. So if you're looking for a healthcare professional account, I suggest keeping your account separate and having a name that's professional. @FuzzyCat is probably not how you want to be referred to when a journal is tweeting out your article. Start to follow people, thought leaders, and organizations who share your interests. Just start following them and taking in the conversation. Do provide your handle when it's requested, when you submit papers, and use the context-specific hashtags that are relevant to your tweets. Tweet other papers of interest. So when you see papers come out, retweet them to start, and then if you want to say something interesting about them, encourage all of your colleagues and trainees to join Twitter and follow specific hashtags, and obviously post anything and everything that's relevant to transplantation. Here's some great tips from the AASLD social media guide about posting great content. Images go a long way. People love pictures. People love infographics. You want your tweets to be succinct but descriptive. So you don't want to just have a few words. You want to say something about it, use the hashtags, but you also don't want to write a book. So again, here's a good place to start. If you want to start following some of these, this webinar will be online, so you can go back and refer to some of these accounts. I thought this was great. Someone actually tweeted this out today, and I incorporated it into the talk today. Thank you to Deanna Behrens at Advocate Health for tweeting it. Essentially, it's really important to start following people outside of your typical network. So you can see employee B, they're just tweeting and connecting with the same people over and over again. But employee A has a very diverse network, and that's the network that I've tried to cultivate, because my network touches adult ICU rehab, it touches social media, it touches women in medicine, it touches science communication, and all of these things are relevant to who I want to be as a professional social media profile. The reason that I bring up the transplant potential is because here we are at Peds ICU. This is 1 month of our data. We had about 1,300 participants in 1 month and almost 8.8 million impressions. And we are a much smaller community than the transplant community. So I encourage someone to register more of those hashtags that are relevant and start collecting data and growing that community as it moves forward. We actually have a one-stop shopping with the Peds ICU tweets handle. So we actually retweet everything that uses the hashtag Peds ICU. So that's another thing to consider for the transplant community. And the bottom line is being professional on social media. So Faris Tamimi, I recommend following him as well, is at the Mayo Clinic, is one of the leaders in this area of social media and healthcare. Don't lie, don't pry, don't cheat, can't delete, don't steal, and don't reveal. Never, ever post anything that is ever potentially going to impact the privacy of a patient. So we've had many employee stories across the world of people who have gotten fired because of a potential breach in patient confidentiality. So you may say something like, there was a gunshot wound last night, it was a really tough night, but people already know where you work, what time it happened, and then people start to put things together. So you have to be very careful about talking about any sort of specific patient care on social media. So HIPAA comes first, which is why it's always great to focus specifically on the literature and knowledge dissemination at the beginning. As you get more comfortable, you can start to foray into social media, patient care, et cetera. And again, another separate talk that hopefully another webinar will be done for that. So my basic Twitter rules as I wrap up is don't ever sacrifice collegiality due to a difference of opinion. Don't ever give specific medical advice or try to diagnose online. Don't ever write about actual patients or cases, even if you think that you've de-identified them. Don't forget to cite the source. So if you go to a conference and you take a picture of a slide, be sure to include the name of the person presenting, or at least, or their handle if they have one. But don't ever just tweet something out and not cite the source or attribute. And don't tweet slides of unpublished data. People have different opinions on this, but I feel if someone says it's unpublished, it's probably not ready for overall prime times or at a conference. Keep it on the down low until they're ready to start sharing it broadly. You don't have to start tweeting immediately. You can just start following along. I call these people lurkers, and it's totally fine to lurk for as long as you want so that you feel comfortable before you start diving in and starting to actively engage. If you have questions about using Twitter, I'm always here to answer those questions. Feel free to follow me, direct message me, send me a tweet, or email me as well. So help me help you with your career development. I hope that this talk gave you some ideas about how to start engaging with social media professionally. And I'm going to stop there for questions and discussion.